assessment and diagnostics in fertility, comprehensive fertility evaluation, detailed patient history taking. A comprehensive fertility evaluation begins with detailed history taking, which helps identify underlying causes of infertility and guides diagnostic and treatment plans. A thorough patient history should include medical history, surgical history, gynecological and obstetric history, family history, lifestyle and environmental factors. First, medical history. Key areas to cover: chronic illnesses, diabetes, thyroid disorders, hypertension, autoimmune diseases, lupus, rheumatoid arthritis, celiac disease, endocrine disorders, PCOS, hyperprolactinemia, adrenal disorders, sexually transmitted infections, STIs, chlamydia, gonorrhea, HIV, medications, chemotherapy, steroids, psychiatric medications, allergies, drug allergies, food allergies. Why is this important? Hormonal imbalances affect ovulation, spermatogenesis. Infections and STIs can cause tubal blockages or sperm abnormalities. Second, surgical history. Key procedures to inquire about: pelvic abdominal surgeries, myomectomy, ovarian cystectomy, tubal surgery, endometriosis surgery, history of laparoscopy, C-section history, scar formation affecting implantation, varicocele repair, men, previous testicular surgeries, bariatric surgery, nutritional deficiencies affecting fertility. Why is this important? Pelvic surgeries may cause adhesions, tubal damage, or uterine scarring. Testicular surgeries can affect sperm production. Third, gynecological and obstetric history. Women, menstrual and ovulatory history, menarche age, first period, cycle length and regularity, painful periods, dysmenorrhea, endometriosis risk, heavy bleeding, menorrhagia, fibroids or clotting disorders, anovulation, PCOS, thyroid disorders, previous pregnancies and outcomes, miscarriages, stillbirths, ectopic pregnancies, infertility duration, primary versus secondary infertility, contraceptive history, long-term hormonal contraception effects, previous IUD use, risk of infection, scarring. Why is this important? Irregular cycles, ovulation disorders, recurrent miscarriages, genetic or immune issues. Fourth, family history, genetic and hereditary factors. Key areas to assess: history of infertility in the family, early menopause, PCOS, genetic disorders, Turner syndrome, Klinefelter syndrome, congenital uterine abnormalities, recurrent miscarriages, thrombophilia, antiphospholipid syndrome. Why is this important? Genetic conditions affect ovarian function or sperm quality. Family history of early menopause suggests diminished ovarian reserve. Fifth, lifestyle and environmental factors. Nutrition and BMI, underweight, obesity, and ovulation and hormonal imbalance. Nutritional deficiencies, vitamin D, iron, folic acid impact fertility. Substance use, smoking, reduces ovarian reserve and sperm quality. Alcohol affects testosterone levels and ovulation. Caffeine, high intake greater than 300 milligrams per day, linked to miscarriage risk. Recreational drugs, marijuana, cocaine impact sperm egg quality. Occupational and environmental exposure, radiation, chemicals, pesticides, heavy metals, toxic to gametes. Excessive heat exposure, men, affects sperm production, e.g., sauna, laptop use. Why is this important? Obesity is linked to PCOS and hormonal imbalances. Toxins and heat exposure can damage sperm DNA. Conclusion: importance of detailed history in fertility assessment. A comprehensive history helps identify underlying infertility causes. Medical, surgical, gynecological, and lifestyle factors influence reproductive health. Addressing modifiable risk factors, diet, smoking, stress, improves fertility outcomes.